Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are here in Los Angeles, California with Dr. Jeff Warburg. Dr. Werber is a practicing veterinarian and has been for over 35 years. He is the founder of Century Veterinary Group and is the former president of the Association of Veterinary Communicators. Today we're talking about sneezing and runny noses in dogs. So Dr. Werber, if you can tell us, is it normal for my dog to have a runny nose or nasal discharge?
Typically it is not normal. When they have it, I mean, it could be something very minor, or it could be something much more serious depending on many, many factors. So most dogs might have a little drip in the morning, cold weather, just as we do. But as far as having a nasal discharge, something that's more persistent, there could be an underlying problem. Understood.
And is there something that I can give my dog at home for a runny nose?
Typically, because there's so many different reasons for runny noses in dogs, if it's bad enough to get your attention, you really should see your veterinarian. It's going to need some diagnostic, a little more history. Is something going on? I mean, it could be maybe nothing, very simple,
right.
But I think you need an opinion.
Should I be concerned if my dog is sneezing at home?
Again, sneezing is a reaction. So we have cilia, we have little hairs, little tiny hairs in our noses, just like dogs. They also have a lot of nasal receptors. I mean, to put it in perspective, why dogs have such great noses, we have about 5 million nasal receptors, olfactory receptors in our noses. Dogs, ready for this? 250 million.
Oh my God.
50 times what we have, which is why they can smell anything. And they do. So, but because of those receptors, not only are they getting the sensory information, but they are more likely to possibly pick up something that's going to cause a sneeze. But if the sneezing becomes persistent, again, need to see your vet.
And is there anything, if my dog is sneezing, but it doesn't seem that serious, is there anything I can give at home for sneezing to my dog?
Well, you can, if you have a really well-trained dog, right? I know you do a lot of training. Ask them to blow their nose. That might help them.
Yeah.
You can imagine holding the Kleenex like you're teaching a baby. Blow.
Yes.
Again, if it's something that's bad enough, you want to get some professional attention. But I mean, one of the things I might recommend, if it's more of just a runny nose and a little sneezing, it's not horrendous.
Yeah.
You want to check with your veterinarian, but I might recommend to one of my clients, one of my pet parents, to maybe try Benadryl or something, antihistamine. Maybe that will help. But I would be very clear if it doesn't work, you need to come in.
Talk to your vet first.
Absolutely.
And so what would be the difference? How would I know, or how would I differentiate if a runny nose or sneezing is really serious or not?
Yeah, as with anything we see in dogs, I look beyond just the actual problem. That we have a very, very technical term in veterinary medicine, ADR, all right? Ain't doing right. So
okay.
Yeah, very, very scientific. And so if the dog is otherwise 100% fine, and it's a little clear, what we call a serous discharge, it's probably okay. You want to wait it out, that's okay. But if the discharge is green or yellow, if the sneezing is erratic, they're doing it all the time. If they not only is that the problem, but they're just sluggish. They're not eating. They're as I said, they're ADR. Just something else is wrong. You do not want to mess with it at home. You need to see your veterinarian.
Yeah, so trust your gut if something seems off or not right.
Absolutely.
Go to your vet.
Absolutely.
That makes sense. And as far as like a cold or a flu like humans would get, can my dog get that? Can they get a cold or a flu? How do I know if it's that? How do I know if it's allergies?
So yes, they can get colds and flus. They don't get cold as we know it, but they have their version. We have the para-influenza. We have now the influenza, which is gaining a lot of attention in the news lately. Now, but as far as the flu, if it's a bacterial type of infection, a respiratory infection, then medication can help. If it's viral, like the influenza and parainfluenza, there's not a lot we can do other than keep them very healthy where we can control, and then hopefully their bodies will kick in and take care of the virus.
Thank you so much, Dr. Werber. And we'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion with Dr. Werber. Now, the medicine you're talking about are there human medicines that we give to dogs in these situations, or will the vet prescribe a dog-specific medication?
It's a combination of both because they are human medications often. A lot of the antibiotics that we would give our dog are the same antibiotics that we take. Now, some are different. Some are related in the same class, like enrofloxacin and ciprofloxacin. Enro works much better with dogs than Cipro. But things like, a very commonly used antibiotic is called Augmentin, right, for the people. But for dogs, it's Clavamox. It's clavicillin with amoxicillin. So Cephalexin and Keflex, these are all the same drugs that we would use. But I don't recommend someone starting without a consult with their veterinarian.
So, some people go, oh, they might just have a little cold or a flu. It'll go away. Will it just go away, or do you really need to go into your vet?
That's really very important to know. And there's the distinction. If I had a patient, that has a mild discharge, it's not green or yellow, it's just like a clear discharge, maybe an occasional sneeze, but is running around, going to the park and eating great and nothing else has changed, I might say just give it a little time. Absolutely. But if it starts manifesting itself in other ways, or that discharge starts turning color, or they start coughing, they have a moist cough where it's obviously going deeper into the lung field, then I'm going to want to see that vet.
Okay, and if you are on the kind of give it a little time, let's see, is it like a couple days, 3 days?
I'd say you give it a few days, and again, you're really watching the other aspects.
Right.
As far as the dog's behavior, appetite, attitude, bathroom habits, energy, and also the discharge itself. As long as it stays clear and it's occasional, and the sneezing is occasional, I'm okay. Yeah. But if it gets worse than that, then I'm going to want to see them.
Okay, great. And with cold or flu, can my dog give me the cold or flu that they have, and vice versa? Can I if I have a cold, can I give it to my dog?
Generally, the answer is no. The dog viruses are dogs. The cat viruses are cats. They can't pass it on to each other. So I'm not worried. Yes, my dogs or my patients that might have a respiratory infection, they still get to lick me in the face.
Got it. Okay. So no boundaries there.
No boundaries there.
All right. Are there any healthy supplements that you would recommend in the cold and flu realm for dogs?
I don't know if it's cold and flu per se, but let's go back to that dog that is otherwise acting just fine. And you want to do something, making sure their immune system is up to speed. I would say, yeah, sure, you can give some multivitamin. I'm a big fan of coenzyme Q10, antioxidants. Yes, but again, I would check with your veterinarian. Some veterinarians think that there's no advantage to these supplements. Then you have a guy like me who says, no, my feeling is if it might help but can't hurt, let's give it a shot.
Right. Excellent. Fantastic. Well, thank you so much, Dr. Werber. That's been extremely helpful. We appreciate it.
Thanks.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. And Pets Best offers comprehensive pet insurance plans that can cover up to 90% of your pet's unexpected eligible veterinary expenses. Together, Pets Best and the CareCredit credit card can allow you to provide a lifetime of care for your four-legged family member. Visit CareCredit.com for more information.
Through October 31st, 2022, earn an entry for your chance to win $2,000 in the Let's Get Digital Sweepstakes. Enter the secret word COLD in the Sweepstakes Hub to earn one entry now. Head over to the Sweepstakes Hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. A purchase will not increase your chances of winning. Legal residents of the 50 United States and U.S. territories, including D.C., 18 years of age or older, who have a CareCredit credit card as of 9/6/2022. Void where prohibited. Promotion starts 9/7/2022 and ends 10/31/2022. Sweepstakes prizes are awarded in the form of a check. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank, 170 Election Road, Draper, Utah, 84020.